Hi, everyone. Welcome back to SynergyTalks.
Guys, today we're going to be doing or giving you guys information based off of intraoral scanning and digital dentures. So we talked on our last episode a lot about what you could do with scanners, what we could accomplish with removable, and how proficient and how much R&D we've put behind the digital platform of doing removable. So today we're going to go over a couple different protocols for digital dentures. We're actually going to demo with the alliedstar scanner. So the model that we have here today is the 100. Unfortunately, they have discontinued those in the United States. So now you can only get the 260 model and the 200. Their 260 model is their wired unit, very similar to the unit we're going to demo with today, just has a little bit better scanning depth, a little bit faster of a processor, and is identical to their 200 model, which is their wireless model, which we do have at the facility as well. And when we went over scanners, we did demo or show you that scanner as well. We're using alliedstar just because of the ease of use of scanning with this particular platform. But as we do additional episodes, we're actually going to do live demos chairside with some of our practice partners with all platforms. So whether it's 3Shape, itero,
Sirona,
Prime Scan, Sirona, and even alliedstar. So we're going to go through and we're going to schedule appointments with those offices. So further future episodes of SynergyTalks will actually show you live with a patient the exact protocol, how to go about it. The protocols we're going to talk about today, or the different protocols I believe that you could do with digital scanning, is obviously things that we've talked about in the past, right? You can go immediate denture, right? That's pretty easy. You're just going to scan the upper, lower, and bite, full arch scan. We're digitally going to extract the teeth and send you back a completed immediate denture for day of surgery. Then you have the next protocol with, if done correctly, is very easy, reduces your chair time, right? So you're not seeing your patients multiple times, and that's your existing denture wear. So I would probably say about 60 to 70% of your patients that are coming in have a pre-existing denture. They've went through the X amount of period of time of what that lifespan was for the denture, and now they're looking for a new one. And that protocol, if done correctly, literally changes the 5 to 6 visit session down to 2 visits.
2 visits. Huge savings.
Huge savings, right? So it's a protocol that we do quite frequently. As we've mentioned in the past, and we do a lot of these protocols with the iteros just because it's more of a popular scanner out in the industry. We have done it with Prime Scan and 3Shape as well too. Today, like I said, we are going to demonstrate it with the alliedstar. And then the last protocol, which isn't as convenient because you're not saving chair time, is when you have a completely edentulous patient that's never had a denture before. Those protocols we'll talk about, I think, after. Let's do a quick demonstration of the existing denture wear, and then from there we can go into protocol steps for the other platforms. Before we go to that point, though, Eric, a couple key points of what you like to see when they're scanning. What deciphers a good scan from a bad scan? What do you think about that?
So you always want to get and capture the integral surface of the existing dentures once you reline it, right? The data acquisition that you're acquiring from the patient is the same as when we're doing a traditional denture, right? As far as the information that we need in the lab. So what you guys want to do is take your time and scan the intaglio surface as best as possible. Obviously, the bite. You also want to capture the vestibular areas as much as possible so that we can produce the denture correctly. The nice thing is, obviously, instead of taking an impression, you have a screen in front of you, so you guys can always reference to the screen to see what you're missing, what you still need to rescan. And it picks up right where you left off. So that's the
best part. I think the best part about doing digital denture copy protocol, meaning what the patient is currently wearing, is that you don't have to do the scanning process completely in the mouth, which makes it very user friendly. Yeah. So you can basically do just the occlusal video acquisition in the mouth. The rest of the scan can really be done extra orally.
I think another benefit of it as well, right? There's so many multiple steps to a denture, and how many times have we seen that we've completed a denture from an analog denture from start to finish, and then they do the try-in, patient looks at it, thinks they love it, Then you go and process it and say, you know what, it doesn't quite look like my old denture. I really do feel, and there's a lot of times you're saying, Doc, if they're wearing an existing prosthesis, or before you prep, pre-digital scanning, send us a photo. Let us see what they have. Ask them, do they like what they have in the mouth? By having a digital scan of their pre-existing prosthesis, specifically in the removable platform, I know it's also reduced our remake factors in the aspect we're giving the patient something that they fell in love with, that they've seen. It's the aspect of that they're used to seeing their self every single day a certain way, but you make that tooth a millimeter shorter, or the neck a little bit narrower. Now they really start nitpicking it. Although specifically in the necks or the gingiva area, they don't really see it because they're not walking around with the cheek retractor in their mouth. They tend to nitpick it when they're looking in the mirror. So by digitizing the protocol, doesn't only just give us the fact of reducing chair time, more convenience to the patient, more profitability across the board, but it's also giving us more accuracy to give the patient exactly what they're used to and happy with, or not. They might say, hey, I've had these dentures for 5 years and I hate this, and this is what I hate.
That's what I was going to say, because let's say they might have had a chip on their tooth, on one of their teeth, or maybe this whole time they really were okay with their denture, but they really wanted their teeth to be just 1 millimeter longer. So we can take this data and very quickly make those adjustments, and then ultimately we can also improve on the shade of the denture teeth as well. So even though you can do a protocol where you maintain exactly what the patient had with a better intaglio fit, you can also do small tweaks. But again, these are just small add-ins that really don't introduce any sort of like delay or hardship in the production process, but they just allow you, by doing it digitally, it gives you like a full suite of tools you have at your disposal to really customize it and make it however you want.
Yeah, and when you're looking at digital dentures, and not to go too far off the course of what the episode is about today, is there's a couple different ways labs produce it, right? And different printers they print off of. One of the things we pride ourselves on is that, we do a Dentsply base, which we've talked about in other episodes, where Dentsply's base is repairable and relineable. It's one of the only materials that we're aware of in the industry that is serviceable. But then there's a couple different ways when you print that prosthesis, what you could do, right? Some labs might use pre-carded teeth. Those are pre-molded teeth that are set to a certain size, a certain shape. And then you have a bunch of different molds you can pick from, but it is selected, right?
Right.
Then you have your printed, which we're not big fans of because we don't feel the aesthetic are quite there.
And the shading, right? The shading with 100%. The printed, it's all one shade.
Absolutely.
With the pucks, you get that transitional
Also the
shading.
strength. I think I'm really iffy on like the strength of the 3D printed resin, especially when you print a narrow wide arch.
Absolutely.
That's really questionable compared to like a Dentsply PMA that was FDA approved to be used long term.
It's a long-term restorative.
Yeah.
It's currently, again, as far as we know, it's the only PMMA in the industry that was FDA approved for long-term use, so not as a temporary. And then the last part of that is because we're milling it, now we can actually design it like we design crowns. Right. So we really could customize that denture to give the patient the aesthetics they want. Yeah. Now, as we said before, if they're pre-existing denture wearer, typically they're going to want to stick to what they had. But the nice thing is that if the patient wants to see something different, maybe they want more teeth showing or less teeth showing, we have a lot more potential to do so.
As people age, the anatomy changes, right?
Absolutely.
So photos are very important because that way we can see what they're currently wearing, where their midlines are, where their canine placements are, where their smile line is. So we can alter that easily by either photos or obviously through the program and stuff. We can do everything. We can change everything around. So
absolutely,
it's great.
So the protocol that you're going to go through while Milos is going to be scanning and showing you how to scan is you have a patient come in. The patient has a pre-existing denture, whether it's upper, lower, or upper and lower, as Milos has in his hand. What we did was we basically just printed 2 dentures out of our try-in material just for cost savings. And we also reverse engineered it and did a reline impression as if you would do in your practice. So patient comes in, they have their dentures. You're going to go ahead and reline that denture with a wash impression. Light or medium body. I don't necessarily recommend heavy body because I feel like it's too thick, too heavy, and it's really going to play with the VDO.
Yes. What I also recommend is not to use fast set because of how fast it sets, it doesn't give it enough time to flow where it has to flow for it to be able to capture the correct VDO. A lot of times that's why we end up with open VDOs because they put it in, they take their time. When the patient bites, it sets faster than the provider
Opens
thinks,
up the bite.
and then it just
Yeah.
keeps the video open. And that's how we can tell by when we receive those scans, we obviously do 2D cross checks and measure the amount of material. A lot of times we'll end up with like 10 millimeters, which we know is definitely wrong.
And also, very important to use the correct adhesive so that the reline material doesn't pull away from the denture. That can also cause problems.
I know some practitioners, because they're going to pull that material out and give it back to the patient, they're a little questionable about the adhesive, and that's fine too. You know, obviously adhesive does help, but just make sure you're getting that material to really seat within the denture. Obviously, in a reline, it's meant to just take up the empty areas of the reduction of the ridge, not to fill usually the whole denture, unless they've went many, many, many years, way too long without it. So what's going to happen is the patient's going to come in, you're going to do a reline impression, you're going to put that denture in the mouth, you're going to scan that upper denture, scan the lower existing prosthesis, and then scan the bite. Then what you're going to do is you're going to pull that denture out of the mouth, keep the reline material in there, and you're going to scan the denture the way Milos is scanning it now. The key thing is, depending on the scanner you're using, the technique of how you capture the data is extremely important. Specifically, I'm going to talk about itero because it is one of the more popular scanners that we're seeing used for this protocol. You want to make sure the prosthesis is fixed. When you're scanning the prosthesis, you want the anterior arch to be facing you, and attack the scanner as if you're scanning the patient within the mouth. You want to start from the posterior ridge, work your way all around the cusp tips and the top of the teeth, the occlusal, and then you want to go on the outer sides of the denture, go back to the posterior. When you're scanning the outer sides, you typically want to go to posterior to like anterior 8, then go to the other side, posterior to anterior 9, then also go and S your way through the top of the palate. Then gradually work your way over the other side of the denture to get the inside of the denture, and then scan that data. With the alliedstar scanner, it is more forgiving. So as you could see, possibly in the camera, Milos is moving that denture. alliedstar, its AI is extremely intelligent, where you just put it over the product, it captures it. So you could see where Milos is scanning this product and the denture, and he's capturing the data seamlessly, effortlessly. I need them to help me with my pronunciation sometimes. And we're grabbing that data. So once you grab that data, you send us those scans. So upper scan, lower scan, bite scan, and full 3D scan of the denture. With that, we can align all the data and we can produce you a new denture. What we do also like to see, like Eric said, we like to get 3 photos of the patient. The photo does help us with making sure the video and the bite is correct. So we want a front face of the patient smiling, a side of the patient. What was the third one?
A side profile, a front profile, actually both sides.
Yeah, so both sides in a front profile. When you're doing the front profile, use cheek retractors so we can get a full, real view of what that denture looks like.
Yeah, and also have them smile and take a look at the camera so we see where their smile line sits. Reason being is we can actually take those photos and import them into 3Shape, and we can utilize those photos to kind of place the anatomical features of the denture that we're producing. Basically how that picture sits. The other thing that I wanted to tell you guys is when you guys are scanning these, the cleanliness around the teeth is very important. So when you have excess material fold up onto the denture, you guys want to take a scalpel blade and cut off any excess, because if we can't see the teeth, how the patient has them on their existing denture, it's going to be very difficult for us to produce a copy denture.
Yeah, another key point is, and obviously sometimes you do, and it's the inevitable, right? The impression material, it might go down their throat. You might have some material hanging off the back of the denture. You want to cut that all off. So anything that's mobile on this denture or loose and not cut and cleaned, like Milos did with the Bard Parker blade, that's going to give you issues in scanning, because anything that moves on this denture is going to throw off the stitching of that scanner, specifically when you're dealing with itero. So what we did is we not only made sure we had a nice clean area all around the denture, we also flatten out the top of the impression material because it gives us reference points for the scanner to get discrepancies to understand the different areas of where it is. The reason why a scanner does so well when it scans on teeth is because the cusp tips, the shape of the teeth are slightly different, so the AI understands where it is in the mouth.
Can I just jump in for a second? Yeah. So now that you see here, by the way, we're gonna have this like fully displayed so that they can see in high detail. When you get those missing areas on the intaglio side, especially in the middle of the ridge, you tend to capture a lot of undercuts. You can just go back with your scanner and just highlight those areas to make sure that there is no missing data. That's just going to give us, or any lab, a really good level of accuracy. And as you can see here, we're going to be able to fully capture the intaglio side that way. So now when we go back, you're going to see that we have everything that we need. If there's small data missing, we can always patch that in our software. Those are really not a big deal. But if you have large areas missing from the scan, then we really have to do a lot of guesswork. Eric, a lot of times that we see is discrepancies with folding from the occlusal onto the intaglio side, right, that border of the denture. So this scanner is very forgiving when it comes to that. Like, you know, basically, like Enrico was saying, you want to work your way on the occlusal side, capture the full palate, and then as you wrap through on the vestibular area, you want to slowly start to pick out that fold, right? When you transfer from the vestibular onto the intaglio side. And once you have a little bit of that data, then you can start focusing more on the actual intaglio side and capture the whole area.
The key thing is, and this is why
switch over to the lower.
Absolutely. The key thing is, and this is why we're going to do additional episodes outside the studio in a dental practice with different brand scanners. The technique of how Milos is capturing the data with alliedstar would be very different with other scanners. Correct. For instance, I could tell you again, and I'll go back to itero. Itero, you have to keep the prosthesis fixed. If you try to rotate your hands and the scanner at the same time, you get a double layer of data. So it's always very important that you're staying steady, you're keeping the arch of the denture facing you, and the scanner is going inward as if it would a patient's mouth. If you start moving your left hand and the scanner hand, say your right hand, that's where you're going to get that duplicate or triple image, and we'll have issues on our side trying to produce that product appropriately for you. So we are going to schedule, and we will let you guys know. Keep, obviously, like I always say, subscribe to the channel so you get the alerts. We'll put it on our social media. What Fridays will be the Friday that we're launching, a chairside itero scan or a chairside 3Shape scan or prime scan. But we are scheduling now with some of our practice partners to do actual live patients scanning, actual full dentures. As we said with this channel, we're giving you a non-biased opinion. So we want to show you every platform in every situation so we could truly, hopefully, educate the world on the best way to do this. We want to digitize the industry as much as possible, whether you use Synergy 3D or any other laboratory.
I will say, though, compared to other scanners, like alliedstar is pretty good. I mean, you can tell I'm zooming back and forth, and it just picks everything up.
Yeah, the AI in their platform, they did a really, really good job.
And for those of you who aren't using alliedstar, there's also tools for you guys. Obviously, the scanners have a little bit of a rough time capturing shiny surfaces, so there's always spray, like quick check spray that you can spray on there. It's very important to keep these things on hand because you will run into situations where you're going to run into trouble scanning certain surfaces. The spray only roughens up, basically, it doesn't matter what color you use. It's really about the surface that it creates.
Or it dulls it, right?
Right. And then that's what the scanner is good at, picking up the rough surfaces. So that's
just and I will say, tip. So here, let's just review this. I have a little missing data here. We're just going to go back and capture that little area there. So, like I said before, after you do the reline, the wash impression and the pickup, you can do this scan extra orally, so outside the patient's mouth, so the patient doesn't have to suffer while you're trying to figure out how to go all around the denture. The only step right now that you're gonna have to do in the mouth is put the reline lower end, put the reline upper end, or if it's just the upper, just put the upper end. Have the patient bite down, and you're just gonna give us that occlusal relationship. So for this particular step, I'm just gonna jump into the occlusal alignment step. Have the patient bite down. And I'm going to do one quadrant. That's done. And we're going to do the other quadrant. That's done. And at this point, we're just going to post-process this, and we're basically done.
Yeah. So as we mentioned, every scanner is going to have a slightly different protocol on how you do it. With alliedstar, it's that easy, right? If it was a natural dentition in the lower, it was a fully edentulous in the upper, you're going to do the same thing he just did, but you're going to scan the upper completely out of the mouth, and then do the bite, the way he just said. So every protocol is a little different. We look forward to doing additional episodes chairside with the other scanners, so we go more in depth of the protocols, because they do vary depending on the scanner you have and the platform. For instance, alliedstar doesn't have a copy denture feature. So it's the 3 scans. You can add an additional scan to alliedstar if you want, but because of the fact that it captures the data so easily, so this is probably the easiest way to do it.
So to add to that, a lot of scanners use soft tissue. They call it soft tissue AI removal. It is basically a feature that once you start scanning for, let's say, a regular crown bridge, it knows how to cut away excess gingiva. So you basically just maintain the tooth structure, the CEJ, and maybe 5 millimeters past the CEJ, just to save data, make it easier. With denture protocols or fully dentureless areas, you want to disable any sort of AI trimming. And what that's going to do is it's going to capture everything you throw at it. So this way, when you do your folds from vestibular to intaglio, or do any sort of extensive like distal extension scanning, it's going to capture all of it. 3Shape has AI. I'm not sure if itero does it internally. They just don't allow you to toggle it. But alliedstar also has AI options. So we basically disable those whenever we want to do a copy denture protocol, do a 360 scan of anything, and the scanner does a phenomenal job.
Yeah, so, I mean, the way scanning has evolved with the amount of R&D we've put behind it, like we said, we do probably 98% of our restorative digital here. We work with our clients directly to get them comfortable in digitizing their platform. If they're not digital, we try to get them digital, and we're not saying that they have to buy an alliedstar, 3Shape, or itero. Whatever scanner they want to buy, we can work with. But the point is by scanning, it makes us all more productive, more efficient, more accurate. Right? It's like Eric said in the last episode, we have clients that say they really don't know their patients the way they used to, especially in a removable platform, because they're not seeing the patient as many times. This particular patient would have had to came back 5 times, right? You have your custom tray, your bite block stage, your setup stage, and your delivery. Pre-custom tray, you have your initial impression, right? So that's your 5 visits, where this is 2 visits. And then obviously for an immediate denture, it's real easy because they're pre-existing dentition. So you could capture the VDO, upper lower scan. With the bite, you get a immediate back. Flexibles, metal frameworks. If you have enough teeth in the mouth to establish VDO, we could go literally scan to finish, and everything drops right in. Right. With the proper scan data captured.
Yeah, absolutely. And at this point, what we would do as a lab is we would take in these scans, we would throw it in our CAD design software, whether it's ExoCAD or 3Shape. And basically, Eric, what we do is we mark the intaglio surface of the existing denture. It turns it into a sort of like a tissue for us, right? So it's a negative, it becomes basically a positive. Basically a model, but it's all done digitally instantly. We mark where the current dentition is of the patient's current teeth, because we want to maintain what the patient currently has, and like Enrico was saying, in terms of aesthetics, size, and shape. And we basically split the teeth and the base. The base gets done out of lucitone. The teeth get milled out of dense ply PMMA material, and those are basically fused together.
together.
And it's a very simple protocol, which is why we're one of the few labs that can actually turn around cases like this in 3 to 5 days.
Yep, 100%. 100%.
So for the next episode, I'd like to go over how do we do this on an itero, how do we do it on trios, and how do we do it on sirona. So at least we basically cover all the main scanners out there in the industry and kind of go over different techniques. As you can see, you're probably going to see this is probably the most forgiving scanner you're going to find that really allow you to like fly around. And then the itero is going to be a little more technique sensitive. And then we will see how do we do chairside with sirona. Chairside should be interesting to actually see what it's like to work in an office and do something like this while the patient's already there, which we will schedule and let you know.
I've done it. It's fun.
Yeah. It's a lot of fun.
Absolutely.
There's blood and saliva everywhere.
So, guys, as always, please like, tag, share, comment, and we look forward to putting this additional content out. We're most excited to do the chairside live stuff so you could really see it. Obviously, scanning a model, there's always that skepticism. Oh, it's not in the mouth. It's a lot easier. It's too shaded. It's not pink. There's no glare. So we look forward in the next couple episodes to bring you live feeds from our practice partners of the actual ones. We don't know which ones will be next because we have to schedule it, but we will bring that real soon. And we always appreciate you guys for watching.
Absolutely.
Thank
and
you.
we'll see you soon next week.
Thank
Take
you,
care.
everybody.
Take care.
Take care.